working with the pubic bone strike. Now, I'm the one who presents a pubic bone strike. No one else looks at it or considers it within development or with any of development. A pubic bone strike is just as significant with an 85-year-old man as it would be with a 2-day-old baby. Do they have a pubic bone strike at 2 days? No, but the pubic bone still needs to come into position and to articulate with your baby. Now, that being said, is working with your baby. Now, in rolling over, let's say, again, this is where you go from a general question into two variations. But let's say to rolling over, right? The eyes, chest, and pubic bone have to be in relationship to one another. You should never see a baby's head move out of position or anything else, or the legs to kick over, that kind of thing, because then that's not rolling over. Move this down just a smidge. You can tell I'm from New York. Right? And so you're starting to see the movements of the pubic symphysis into the relationship of development, right? It comes into play, and this is the center of most of your reflexes based off of the pubic bone that you looked at. And then at about 4.5 months, your baby is what people look at as ST and R, but the significance of it is that your baby will have a little bit of a bounce. And that's what it is. At 4.5 months, you should sort of get a pubic bone strike when it's coming in. STNR, they look at it with the back, but really it's the presence of the pelvic bone. The hands become independence in play, and this is also when that pubic bone strike articulates the tongue out, and then we start feeding your child, rice, cereals, whatever, if you want to feed your child. But the pubic bone strike is there. When you have these kind of things and the struggling, when you're having the rolling over like that or like this and that flop, you're not getting that same kind of movement, and this is where it comes into play. It doesn't matter how and what position you're working on the pubic bone. It can be in any position. I call it professionally, though, I call it the diaper factor. If a child or you're not wearing diapers, I'm not working in this area. I will find other wet methods. That's why I do cage work, or I work with TheraBands or something like that to work on that articulation. I've done a couple adults, good friends of mine, because they want to experience the touch, but I'm not teaching it, and that's a big joke with me. But when you're working with a child, the pubic bone, when you're working with anybody, should feel almost like that light tonus that you'd get from a bow and arrow. Now, I'm not looking for a full 66-pound draw, or you know what I mean. Like, I'm not looking for that kind of movement, but that rotation is there within the pubic bone area, but it just gives just a little bit of tension, and that tension, literally, guys, can be like seaweed. It's just like seaweed. There's nowhere in movement lesson that I am getting out the Acme hammer. It just doesn't work. When I try and create any kind of force, or especially resistance to a movement that creates any area of the body to stop, you now are no longer working on a milestone. You're not working on development, right? So if you're working on the push-pull milestones and so forth, you're just sort of guiding, again, that weight transfer in and out. And you want just that little bit of tension. That tension's very similar to this. So if you're working on, let's say, mouth movements, right? And stuff, one of the things is our tongues can create a force, right? That comes from the pubic bone. That starts. That's why, again, making a raspberry is a very important milestone that gets overlooked by people, because they're not seeing that, right? That's riding a bicycle. That's being able to read. You're not going to get those skills if there's no conversation of changing the way the movement is. Now that it's the season of Christmas Carol, when I'm looking at introducing a movement, the scene at the end of the Christmas Carol, the Christmas future, where he's like, if these shadows remain unchanged, like if I didn't work with my son wouldn't have walked or talked, right? And it sounds like, oh, you know, no, it's not. It's just that I didn't go with their course of action, which is a really big problem when kids have a developmental diagnosis, is because people, I wouldn't say that the give up factor is higher, but you're thinking, oh, what am I going to do? My child has got genetics, or my child's got, so what? You know what I mean? This is why it's about optimal development. But when you're touching the tongue, I don't want to stop the tongue, but just give that resistance. That's sort of the touch that you're using for the pubic bone. You're just giving that resistance. That resistance, the first touch too, is that push-pull milestone, is when they're first touching breast tissue. One of the reasons why nursing is that, Paul. They do it with their eyes too. You know what I mean? When a kid sees something, it's like they're throwing darts with their eyes. When they're not typical, you'll see that the filaments sort of almost fall backwards. It's a completely different function of the eye. And these all come into play. So when I'm looking and working with something, I'm not just working with that area. You know, I'm working, when I'm working, let's say, with the pubic bone strike. And again, I can just be right here watching Netflix, I say Netflix all the time. You think I watch TV all the time. I don't, but it's probably more Amazon Prime if we have to get creative. But I literally can be right here and be working on pubic bone strike, and especially if my child is going to grab for something, right? And I'm just right there, just offering that little bit of resistance. That resistance I need if I'm working with an ice skater, let's say a high-end performer. They better be able to drop that pelvic floor like you wouldn't believe, right? But again, they're doing it with the plumb line of the pubic bone versus the whole pelvic floor. 26 bones in our feet, you know what I mean? And our pelvis really can do a heck of a lot more than you think. Go Google belly dancing. But again, these are more high-end things, but you can really be working on various aspects of pubic bone engagement, but that engagement, what I'm still looking for, to get a pubic bone strike and work on vision at the same time is much more powerful, or a raspberry is much more powerful than just saying I'm working on the pubic bone. But I get it. This is where, you know, when you're asking a question, I mean, I could do a whole encyclopedia on just pubic bone strike and gymnastics, much less on infant development. So that's what you're looking for, though, is that touch, that draw. Again, not a full-on, you know, like, again, it's not a full-on crossbow, but it's again that push-pull when you're bringing back something. No difference even if like these beads. These beads their gravity has a weight to them, right? And I'm just bringing them back, right? There's a light draw, but I'm not grabbing them. I'm not breaking them. I'm not doing something like this, but this is what should be happening in their system. And the same thing too, and the diaphragm releases and comes down over. Again, all these people doing fascia releases and they're going that route, you're just not going to have the same qualities of movement, and they're not going to transfer over into milestones, because you can't just release an area or work on an area. It really has to be as part of that whole program where that diaphragm can come down to the table and then away again. That's what you're looking for, that quality. And so when a kiddo is rounded or has a scoliosis, again, that it's going to be a different touch to the pubic bone, but you're just going to get that with practice, and it's okay. But I do better with something like that if you just did a quick video of what you're working on, and I can get very specific to your needs versus just having a general conversation on the touch.